How much does cataract surgery in New York City cost? In this video, I will give you the inside story about the actual cost ranges and the value for your money when thinking of different types of cataract surgery, from the traditional to laser cataract surgery and monofocal lens implant to a variety of premium lenses. Okay, wait a minute, isn't cataract surgery covered by insurance? Well, it depends on the type of cataract surgery and what it is that you want it to accomplish. Insurance companies cover the cost of the traditional cataract surgery performed with a blade. If you're looking for laser cataract surgery or looking to decrease your dependence on glasses with premium lenses, you need to pay a significant amount of money out of pocket for these perks, in addition to what the insurance company pays for the traditional services. But most people don't understand what it is exactly they're paying for. Of course, your doctor recommended a certain type of surgery, perhaps with a significant out-of-pocket expenses. Should you go for it? Or maybe you should dig a little bit deeper. Here's the part that no one tells you. Two patients can get cataract surgery in the same city, and one could pay nothing out of pocket while the other one can pay over $8,000 per eye. And the difference isn't just price, it's what they're actually getting. I've been doing cataract surgery for over 25 years. I've seen people pay top dollar for technology they didn't need, and on the flip side, others walk away with blurry vision because they didn't understand their options before the surgery. That's exactly why I'm making this video. I'm going to break down what cataract surgery really costs in New York City area in 2025. What's worth paying for, what's not, and how to avoid getting overcharged or undertreated. Let's start with one of the most talked about upgrades in cataract surgery, the laser. The laser isn't the same as the lens implant. It serves a completely different purpose. It's designed to make the surgery safer, less traumatic, and in some cases, help deliver a better vision. But how much of that promise it actually delivers? Some patients absolutely benefit from the precision and the gentleness of laser-assisted surgery. Others might not notice much of a difference at all. And here's something most people don't realize. The value of the laser depends heavily on who's using it and what kind of laser they're using. That's why I made a separate video where I break it all down, how it works, what it actually does during the surgery, and when it's worth the cost. You'll find that video right here on the channel in the description below. Be sure to check it out if you're serious about getting the best results. But while laser may help make the surgery itself smoother and more accurate, there is another upgrade that can actually change how you see every single day after surgery. This one's not just about safety. It's about freedom from glasses. Let's talk about lenses. If the laser helps during the surgery, premium lenses change what life looks after the surgery. When we remove a cloudy cataract, we replace it with a clear artificial lens. The standard lens covered by insurance company only corrects vision at one distance, usually far. And that's only if the proper lens power was chosen and you have no significant astigmatism. That means that even if you're lucky and all went well, you still need glasses for reading, computer work, or anything up close. But premium lenses, they're designed to give you a wider range of vision, far, intermediate, and near, so you can do most things without glasses. There are a few different types. Multifocal lenses. These lenses allow you to see clearly for distance, intermediate, and near work. Extended depth of focus lenses. They provide a smoother vision for distance and computer work. They're not perfect for reading, but they might be the only choice if you have certain eye conditions. And toric lenses, which correct astigmatism. In New York, premium lenses usually cost between $2,000 and $5,000 per eye, depending on the type of lens, other services offered, and the surgeon's
skill and experience. And unlike the laser,
which helps during the procedure. Premium lenses impact your daily life, how you read, drive, use your phone, even how you see your loved ones. If your goal is freedom from glasses, this is where your money makes the biggest difference. But here's where things get tricky. Some practices bundle the laser and the premium lens into one premium package. Sounds simple, right? But that simplicity can be misleading because not all bundles are created equal. Many surgeons offer cataract packages that combine the laser, a premium lens, advanced diagnostics, and sometimes even post-op care, all in one price. It sounds convenient and it can be, but here's the problem. Two surgeons can offer what sounds like the exact same package, and yet the value you get can be completely different. Let me give you an example. One office might offer $5,500 per eye and include a top tier lens, the most advanced laser system, full diagnostics like topography and OCT, and a highly experienced surgeon. Another might charge the same or more, but give you an older lens, a basic or outdated laser, minimal diagnostics, and a less experienced surgeon. On paper, the price is the same, but the outcome, not even close. That's why understanding what's inside the package matters more than the price tag. If you can't rely on price alone, how do you know what's actually worth it? Here's a simple framework I give my own patients. Let's talk about what you're really paying for. Here's the breakdown. For premium lens implants, $2,000 to $4,000 per eye. That includes either multifocal, extended depth of focus, or toric lenses, each with different benefits depending on your lifestyle. For the laser upgrade, $1,200 to $2,500 per eye. It helps make the surgery smoother and more precise, but only in the right hands. Advanced diagnostics. This is really important because measurements determine the power of the lens that is inserted into your eye and therefore your final vision. If the measurements are not accurate, it doesn't matter how advanced the lenses are. You won't see perfectly. The cost, $350 to $950. This usually includes corneal topography, macular OCT, and precise IOL measurements, sometimes using multiple different biometry devices to increase the accuracy. Surgeons' expertise, priceless. It's not just what tools are used, it's who's using them and post-op care and touch-up policies. Some centers include enhancements, others charge extra. Please pay attention that depending on which borough in New York City your surgeon is located, the price may range widely. For example, a surgeon in Midtown Manhattan or Upper East Side typically charge significantly more on average than doctors that are located in Brooklyn or the Bronx. So the real question isn't how much you're paying, is are you paying for the right things? A $6,000 surgery might be overpriced or it might be a steal depending on what's behind the curtain. So now you know the cost of cataract surgery in New York isn't just a number. It's a reflection of the technology, the surgeon's experience, and the quality of vision you live with afterwards. Laser or no laser, premium lens or standard, bundle or a la carte, the right choice comes down to knowing what you need and who you trust to deliver it. If you're wondering whether the laser is really worth the extra cost, watch my video on laser versus blade cataract surgery. I break it down step by step. And if you're asking yourself, how do I even choose the right surgeon? I made a separate video for that too. What to look for, what to avoid, and what truly matters. Both videos are linked below in the description. If this helped you, please give it a like, subscribe, and share it with someone who's trying to make the same decision.